According to the CDC, surgical site infections complicate an estimated 500,000 operations each year, and healthcare-acquired infections are the sixth leading cause of death in the United States, killing almost twice as many people as breast cancer and HIV combined. As a sterile processing employee, you play an important role in breaking the chain of infection. You can help ensure through meticulous decontamination and appropriate sterilization that reusable instruments are not the cause of patient-to-patient disease transmission and a subsequent surgical site infection. One of the most important links in breaking the chain of an infection is to make sure your sterilizer is working properly. In the beginning, before it even arrived at your healthcare facility, a sterilizer model was designed, extensively tested, and cleared by the FDA. Getting clearance wasn't so simple. Sterilizers must be tested against requirements that help ensure both the safety and efficacy of the device. The steam sterilizer manufacturer demonstrates efficacy with biological performance tests using biological indicators, BIs, containing Geobacillus stereothermophilus spores. Your sterilizer has specific sterilization cycles programmed into it. Sterilizer manufacturers use biological indicators to validate sterilization cycles because BIs provide a challenge to the sterilization process that exceeds the challenge of the natural bioburden in or on surgical instruments. Manufacturers rely on the concept of SAL, sterility assurance level, to define the probability of a surviving organism for a validated sterilization process. And now it is your sterilizer and therefore your responsibility. Before your facility even puts your sterilizer into use, you must perform sterilizer qualification testing to assess the sterilizer's performance in your environment using your very own steam supply. Sterilizer qualification testing for dynamic air removal sterilizers is performed with physical monitors, chemical indicators, Bowie-Dick tests, and biological indicator process challenge devices, PCDs. The BI-PCDs present a challenge to air removal and steam penetration and must yield negative BI results from 3 consecutive cycles. These tests are important because the conditions are not the same in every clinical setting. For example, the steam quality is unique to your location, the climate and the altitude are different, and the electrical integrity is not the same everywhere. Acceptable qualification testing results demonstrate that the sterilizer is in good working condition and is functioning effectively. There are thousands of surgical instruments processed in your sterilizer every day, but do you know what actually happens in there? In typical pre-vacuum cycles, air is actively removed from the chamber and the contents of the load during the preconditioning phase, which includes a series of steam injections and vacuum pulls. At the same time, the temperature in the chamber increases to the selected cycle temperature, much like the preheat cycle in your oven at home. The right combination of saturated steam, time, and temperature are needed to ensure sterility. When sterilizing by steam, it is imperative to first remove air, not only from the chamber, but also from the packs and containers being sterilized. If you don't, steam might not reach all device surfaces, which could result in non-sterile items being used from a seemingly acceptable sterilization cycle. Once the parameters are reached, the exposure phase begins and the sterilizer runs for the selected cycle time. To ensure packs are dry at the end of the cycle, the exposure phase is followed by a final vacuum and drying time, because any moisture on the packs can lead to microbial growth. So what does all this mean? It means that testing with biological spores is required by the FDA for clearing both a new sterilizer model and for validating the sterilization parameters required for reusable medical devices. Chemical indicators cannot be used to demonstrate achievement of a sterility assurance level, SAL. Sterilizer qualification testing at your facility also requires the use of biological spores. The next module will discuss why BIs are also a part of your comprehensive monitoring process to ensure your sterilizer continues to deliver lethality on a load-to-load basis. Sterilization process monitoring is about more than cycle temperature and time. It's about whether or not your sterilizer successfully delivered enough lethality to kill all the microorganisms in a load of surgical instruments.